Most people know about calcium. Many even know about vitamin D. But there's a hidden nutrient that quietly decides whether that calcium actually strengthens your bones or clogs your arteries. It's called vitamin K2, and despite being one of the most powerful bone protective nutrients, hardly anyone talks about it. Today, we're diving deep into why vitamin K2 might be the missing link in your bone health, how it works with calcium and vitamin D, where to find it naturally, and why ignoring it could lead to long-term damage, even if you think you're doing everything right. The forgotten vitamin. For years, bone health advice revolved around calcium and vitamin D. Take your supplements, drink your milk, get some sunlight. But here's what many people don't realize. Without vitamin K2, much of that calcium never reaches your bones. Instead, it can end up where it doesn't belong, in your blood vessels, joints, or soft tissues. This calcium misplacement is one of the hidden reasons why some people develop arterial calcification, hardened arteries, even while trying to protect their bones. Vitamin K2 acts like a traffic controller for calcium. It tells calcium exactly where to go, and just as importantly, where not to. How vitamin K2 works in the body. Let's get a little scientific for a moment. Inside your body, calcium needs certain proteins to bind it and move it to the right places. Two key proteins handle this job: osteocalcin and matrix GLA protein, MGP. Osteocalcin helps lock calcium into your bones and teeth. Matrix GLA protein prevents calcium from building up in arteries and soft tissues. But here's the catch. Both these proteins need vitamin K2 to activate. Without K2, they remain inactive, like workers without tools. So even if you take all the calcium and vitamin D in the world, your body can't use them properly unless vitamin K2 is present to switch these proteins on. In other words, vitamin K2 doesn't just support bone health, it controls it. Vitamin K1 versus vitamin K2. What's the difference? You might be wondering, I already get vitamin K from leafy greens. Isn't that enough? That's vitamin K1, which is found in foods like spinach, kale, and broccoli. It mainly supports blood clotting, not bone health. Vitamin K2, on the other hand, goes by a few different names. Menachinones, or MK for short, like MK4, MK7, and so on. It's found in animal products and fermented foods, and it's the form your body uses for calcium regulation and bone metabolism. While K1 and K2 are related, they have completely different roles. Think of K1 as the emergency responder for wounds, and K2 as the architect building your bone structure behind the scenes. Why most people are deficient in vitamin K2. Here's the scary part. Most people today don't get enough vitamin K2. Modern diets are heavily processed and low in traditional sources of K2. The best natural sources, things like grass-fed dairy, egg yolks, organ meats, and fermented foods, are often missing from daily meals. And while your gut bacteria can produce small amounts of K2, it's usually not enough to meet your body's needs, especially as you age. This deficiency silently increases your risk for osteoporosis, fractures, and heart disease. Because when calcium isn't properly guided, it doesn't strengthen bones, it hardens arteries. So if you've ever wondered why bone density keeps dropping even with calcium and vitamin D supplements, vitamin K2 might be the missing puzzle piece. Vitamin K2 and vitamin D3, the perfect pair. Here's where it gets interesting. Vitamin D3 and K2 work like a team. Vitamin D3 helps your body absorb calcium from food and supplements. But once that calcium enters your bloodstream, K2 takes over, ensuring that calcium ends up in bones, not arteries. Without K2, vitamin D can actually make things worse by raising blood calcium levels without properly directing it. That's why many experts now recommend taking vitamin D3 and K2 together, especially for people at risk of bone loss or heart disease. It's not about taking more calcium, it's about making sure your body uses it correctly. The research behind vitamin K2, scientific studies are now catching up to what traditional diets have shown for centuries. Populations that consume high amounts of K2-rich foods tend to have stronger bones and healthier hearts. For instance, a landmark Dutch study, known as the Rotterdam study, followed over 4,800 adults for a decade. The results were stunning. People who consumed the most K2 had 50% lower risk of arterial calcification and a 26% lower risk of dying from heart disease. Other studies show that K2 supplementation can increase bone mineral density and reduce fractures in postmenopausal women, one of the most at-risk groups for osteoporosis. In Japan, doctors even prescribe high doses of MK4, a form of K2, to treat osteoporosis, with remarkable success. So, when you think of vitamins for bone health, calcium and D3 are only half the story. Vitamin K2 completes the equation. Natural food sources of vitamin K2. Getting K2 naturally is easier than it sounds, once you know where to look. Some of the best food sources include arteries, natto, a traditional Japanese food made from fermented soybeans. By far, the richest source of vitamin K2, especially the MK7 form. Grass-fed butter and cheese. Hard and aged cheeses like Gouda and Brie are particularly high in K2. Egg yolks, especially from pasture-raised chickens. Organ meats. Liver from grass-fed animals contains valuable K2. Fermented foods. Sauerkraut, kimchi, and other traditional ferments can also provide small amounts. If you rarely eat these foods, a high-quality vitamin K2 supplement, preferably MK7, can help fill the gap. How much vitamin K2 do you need? There's no universally agreed daily recommendation for vitamin K2 yet, but research suggests that 100 to 200 micrograms per day is enough for most adults to support bone and heart health. If you're taking vitamin D supplements, combining them with K2 is essential. Many modern formulas now include both because that's how your body naturally works. However, people taking blood-thinning medications like warfarin should talk to their doctor before adding K2, as it can affect how those drugs work. What happens when you get enough vitamin K2? When your body finally gets enough vitamin K2, the results can be transformative, though subtle at first. Your bones become denser and stronger because calcium is being locked into the right places. Your risk of fractures goes down, and your arteries stay more flexible because calcium isn't building up there. It's not an overnight change, but over months and years, it could mean the difference between brittle bones at 70 or still walking strong at 90. That's the quiet power of vitamin K2. It doesn't shout, but it protects. The takeaway: the missing link in bone health. Bone health isn't just about how much calcium you consume. It's about where that calcium ends up. Vitamin K2 ensures that every milligram of calcium and every unit of vitamin D actually contributes to stronger bones and a healthier heart. Without it, your efforts may be in vain. In a world obsessed with single nutrients, K2 reminds us that health is a team effort. Vitamins, minerals, and enzymes all rely on one another. And K2 is one of those unsung heroes that quietly keeps everything working in harmony. So the next time you think about your bone health, don't just reach for calcium or vitamin D. Remember the hidden vitamin that makes them work. Vitamin K2, the bone health vitamin no one talks about, but everyone needs. If you found this helpful, make sure to subscribe for more science-backed health insights. And before you pop your next calcium pill, ask yourself, is vitamin K2 on your side? Because real bone strength doesn't just come from what you take, it comes from what your body knows how to use.